being a family member, I was a witness to that for as long as I can remember. And I wanted to get into the counseling field. And that really struck a chord with me, just being able to help not only the people who are struggling with substance use, but also the ripple effect of the family members and friends around them that are also being affected by the substance use, and ultimately the community. So that was why I got into it. So yes, I perform individual therapy with my clients. I do group therapy counseling with them as well. In the county jail, anybody who has a substance use disorder can work with me and receive counseling while they're there. So hopefully we can reduce the amount of people going back and having repeat offenses. And with treatment court with the county, I work closely with our clinic and helping coordinate things with the court. So everybody's on the same page and getting the right kind of resources and help that they need when they're going through some pretty severe legal trouble at that same time. So I'm going to start with just giving an overview of what addiction is. So basically, the American Psychiatric Association actually defines it as a complex condition in which there is an uncontrolled use of a substance despite harmful consequences. So that's a big fancy definition of it. But ultimately, I'll break it down a little bit more to actually how it can develop, where it comes from, which is kind of a loaded question. So it's different for everybody. There's varying reasons why somebody can develop a substance use disorder. So over time, really, it has been proven that there is a genetic component to it. So it can run in the family. So there is that genetic component that you can inherit, but also the environmental factors. So if you are somebody who is in a situation where you have that genetic component, but also have the environment that's conducive to developing a substance use disorder, the two of those team up, and unfortunately that can turn into a substance use disorder. Not that everybody who has those two things ends up developing a substance use disorder, but those are the kind of the breeding ground for that to develop. So there's a lot of talk that you might have heard in general about, is it a disease? Is it not a disease? So something just to maybe kind of clarify and make it kind of easier to understand, I like to look at it as similar to something like diabetes. So you might have that genetic component of diabetes running in your family. Doesn't mean you'll develop diabetes. However, if you don't eat very well, if you eat unhealthy, if you don't exercise as much and struggling to keep your weight under control, diabetes can develop from that. So not everybody who has that genetic component will develop diabetes, but you're at a higher risk. There's an increased chance to develop that. So I like to look at addiction that same way, where there's not that, for sure chance that it will develop, but there's an increased chance that it will develop given variables that play a part in the development of it. So ultimately, the environment, that's a really big component of it. So for people, if they grow up in an environment where there's already substance use in the home, if they're family members, whether it's their parents, their guardians, their immediate family, if that's already happening in the home, they're exposed to it ultimately. So if they also have that genetic piece going, plus they're exposed to it on a regular basis, it creates a difficult environment to learn how to use better coping skills or healthier coping skills, or to avoid it altogether. Also in school, unfortunately, people are exposed to drugs at a young age, when most people their first experiences with it are early on in their teen years. And that social group, which is ultimately a part of the environment, if their peers are using or experimenting, it increases the chance of that person also experimenting and developing a substance use disorder over time as well. So a really important piece of all of that is knowing family history and teaching family history. So I know personally growing up, drug use oftentimes was not talked about. It was very taboo, and I think we've come a long ways with discussing it and being more open to talking about it. But it is honestly still something that a lot of families still struggle with. And even in my clinical practice, it's still a lot of my clients who have children of their own, they have to kind of weigh the pros and cons of, when do I talk about this and how do I talk about this? And I want to make sure my kids don't go down this path. How do I change that? And ultimately, being aware of that family history is super important. Talking about it with our kids when they get old enough to understand, and trying to give them that support there so that they know. If you don't know you have a genetic predisposition to develop some kind of disease, you can't put those safeguards in place. So if you know that addiction runs in your family, you might be a bit more apt to put those safeguards in place to protect yourself and make sure that you're not in a situation where that could develop. So same thing with the diabetes example. If I know diabetes runs in my family, I might be a bit more prone to be watching what I'm eating and exercising and monitoring blood sugar levels and things of that nature to make sure that everything is running the way that it should be, and I'm trying to stay as healthy as I possibly can. Ultimately, all it takes is one use. So if we, going back to what I said previously about kids experimenting when they're teens, in my experience, the most common ages that I usually see people starting off is between 13 to about 16, which I know seems very young, which it is, but that's when people start experimenting with things. And so thinking about it from the perspective of what the brain looks like at that point, it's not fully developed. And I'll get into a little bit more of that after this, but if somebody experiments with a substance, whatever it is, it could be marijuana, it could be an opiate, cocaine, anything. When the brain is not fully developed, it's automatically changing the makeup of the brain. So the brain, when it's not quite there yet, it's still growing, it's trying to get to that end point, which for most people, it's about 25, 26 before the brain fully stops developing. So if you're about 15 and the brain's just not quite there yet, it's still trying to grow, but then throw a substance in on top of it, it's going to affect the way that brain is made up and the different parts of the brain and how they function. So then trying to make having problem solving skills and rational thinking is going to be impacted by that, unfortunately. So it's commonly used drugs. So just a couple of statistics from the Department of Health. Between 2010 and 2017, there was a 200% increase in opioid overdose deaths during that time range, 200% increase. So most people are aware that we've been struggling with an opioid epidemic for several years now. So I think most people know that it's there, but I don't know if everybody really understands the numbers and sees the numbers of how severe it is. And I think for myself too, just living in this area, in a small rural area, I think a lot of the perception is that it's a rural area, so it's not happening quite as much. But it's here as well. It's not just a city thing, which is unfortunately some of the beliefs that we tend to run into. In 2018, that was the very first decline of opioid overdose deaths. So there was a 7% decline at that point. So we're still working on it. We're still struggling. There was a lot of years built up that came to this, that led to this, the opioid overdose deaths. But largely it was due to the use of fentanyl. So for those of you who don't know, fentanyl it was originally developed to help terminally ill patients to manage their pain. So it's a very strong pain medication. But once it started getting abused, it got out to the streets and it very quickly spread. And it takes a very, very small amount of fentanyl to overdose on. So at one point, you didn't really hear about fentanyl. You didn't hear about that. It was heroin when you talked about opioids. You didn't hear about the fentanyl as much. And now at this point, it's mainly fentanyl. But unfortunately, it's people get tricked sometimes too, thinking that it is something different, but it's laced with fentanyl. And so they might think that they're using something different, but there's really fentanyl in it. And if they don't know, then very quickly can overdose from it. So just a little bit more of a background as far as drug use starting and the development of it. It involves a lot of impulsive thinking. So again, going back to the brain development, if we're looking at those teenage years, I think we all can think back to when we were about 13, 14, 15 and our mindset at that point versus the age that we're at now, two very different mindsets. But when you throw a drug in there on top of that, it can really distort the thinking, the thought processes, and how we view the world. Even nicotine use, it's still a drug, and that's something that's very commonly starting around the age of 13. So in this area, I would say that alcohol, opioids, and marijuana are the most common drugs of choice that we see, and most commonly starting at an earlier age. Usually in the teens, we see the alcohol and marijuana is starting around those ages, but it can quickly spiral into more than that. There's a lot of social triggers. So even as an adult, this is something that a lot of people struggle with, but peer pressure. So dealing with your social circle, your friends who are using, but even as adults, that's something that people really struggle with as far as developing new sober supports. And if the only people that they know are people who also use as well, makes it very difficult to have those safe supports around you if you don't have people who are also clean as well. So eventually when I get to Dawn, she's going to go over all the awesome peer support stuff, which really helps in that part of it to get some additional sober supports there. But it's really a struggle, especially in, I think, any small area like this, a small rural area. We don't have as much access to things and social events and outings and things like that. So the sober supports are really important, but it can also be a major trigger for people to develop substance use as well. Also lack of coping skills, bullying at a young age can be major triggers for developing a substance use disorder. So bullying, unfortunately, is something that happens to most people at some point in, while they're growing up, and sometimes even as an adult as well, but it's very common in school. And with lack of coping skills and that impulsive thinking that unfortunately is with most teens, it can progress into seeking an escape of some kind to numb those feelings and numb the negative emotions that are coming from that. And then again, going back to that toxic or unhealthy home life, if you come from an environment where there's a lot of substance use already going on, where it's kind of normal, and that's just what everybody in your family is doing, it seems, doesn't seem out of the ordinary to go to something like that in order to help with those negative emotions and feelings. Thinking about adults, though, in the opioid epidemic, one of the most common reasons I see adults developing opioid addictions is ultimately having a surgery of some kind, getting injured, and getting prescribed a pain medication for that. So I've been in the field for a little bit now, like Erin said, almost 10 years, but when I first started in the field, it was very different how they prescribed opioids compared to now. There's many more restrictions now that are used to combat the opioid epidemic. But at one point, people were having injuries and those surgeries, like I mentioned, and that those discussions for tapering off of opioids were not happening quite as frequently with people. So there was a misunderstanding, I think, for a lot of people where they didn't understand that you can still develop a physical dependence on something, even though you're taking something that's prescribed. So you can go in and have your surgery and get prescribed a pain medication to treat your legitimate pain, but that will still develop a physical dependence. And I think because drug addiction and substance use has been kind of taboo over the years to talk about, I don't think there has been that clear communication of that physical dependence can still happen. Your body can still become dependent on it, even though you're taking it as prescribed and you're not abusing it. So for a lot of people, if they try to come off of that medication after a surgery, an injury, anything like that, they weren't aware of that physical dependence and how their body would react, the withdrawals to it. And for those who don't know, an opioid withdrawal is not a fun thing to go through. It's very intense flu-like symptoms, can last for most people about 3 to 4 days before it starts getting better. But in the midst of it, it's pretty intense. So I think the more education that we get out there about, proper use of medications and the side effects and how to come off of medications, all of that is really helping. But at one point, I think that wasn't happening quite as much. So people would have that physical dependence and not realize it. until they were trying to come off of their medications. But yes, that's ultimately has been a very common trigger or start to people's addictions, has been getting an injury or surgery of some kind. And then ultimately trauma. So trauma is a major component for most people with substance use disorders. And I know at one point, most people thought of trauma as being directly related to military experience, which absolutely is a form of trauma. But we all have our own traumas. We all have our own events that we've been through throughout our life. And trauma looks a little bit different for everybody. So what Dawn went through at one point for me might not be as much of a trauma, but for her, it might have been, and vice versa. So because everybody has their own sources of trauma throughout their entire life, it affects people differently. But because it is so prevalent for most people, it is a very common reason that people start experimenting with substance use, again, to numb those negative emotions, to escape, if it's, and also depending on how severe the symptoms are. Some people don't feel that they don't get to that point where they think they need to get an escape from that. But for some people, it becomes so severe and they feel very alone that it develops into an addiction just to solely escape those horrible feelings that are coming from it. And again, it also plays into the part of the home life. So if you're in, whether you're a child or as an adult, if you are in an environment where it's conducive to substance use and you're also struggling with the effects of your trauma, it all ties together and just creates a recipe, unfortunately, for substance use. So then ultimately for treatment. So treatment looks a little bit different for everybody. So again, Dawn eventually will get to the peer side of it. But as far as the outpatient treatment options go, so kind of a day in the life. So if you came in for an intake, you would see an intake clinician. They would go through an assessment with you. You'd have the option to stay with that person or transfer to another clinician to actually start your therapy. And at that point, you go over treatment recommendations and what that might entail. So again, it looks a little bit different for everybody. So somebody might come in weekly individual sessions might be enough. Just meeting with their counselor one-on-one, that might be enough for that person. There's also the option of doing psychiatric rehabilitation sessions. So that is honing in on specific skills. So say you're somebody who really struggles with, say, anxiety. Meeting with somebody to specifically work on those exact skills to help yourself in those situations. Then you can go back to your individual counselor and work on more of the broad therapy goals that you have for yourself. We have that peer support that Dawn will discuss. We also have group therapy. So group therapy, if you've never been in that situation, it's a really awesome, great tool for people, especially with substance use disorders. There's actually been a lot of studies done on group therapy of how important and positive rates that come from it as far as helping people combat their symptoms. So really, if you've ever seen it on TV or anything, it's just like that. You come into a room and it's a circle of people. You sit down with your peers and you discuss what's going on, what symptoms you're struggling with, stressors that you're dealing with. And getting that direct feedback from people that are right there with you, who are going through maybe similar situations or have been through even sometimes the same situation that you've been through. It always helps, I think, for people to hear their peers discussing or giving them feedback. They can meet with their clinician and go through individual therapy, but when they also have their peers giving them positive feedback, it goes a long ways as well. But there's also that accountability. So coming into a group therapy session, and unfortunately relapse happens in recovery, but going into group therapy and having that discussion with their peers and discussing what happened and what can we do differently, it's a really beneficial conversation for people to have to help them better themselves in their recovery. We also have a psychiatric nurse practitioner here who, if the client so desires, they can meet with him and go through any potential medications that might help combat the symptoms. We also have a Suboxone clinic here in our clinic to help combat the cravings for opiates. Suboxone also helps stop the high if somebody was to try using while they were taking the Suboxone as well. So kind of a safety measure there to help people with the opioid epidemic as well. So that leads me to our peers. So it's a phenomenal resource that we have. I'm actually really thrilled that we have this, because back when I started, we did not have this option in the field, and it's so beneficial for people. So Dawn, I'm going to throw it on over to you so you can discuss that. Thank you, everybody.
Thank you.
Okay. So, all right, I'm Dawn Stone. I am a peer here at Spectrum Human Services. I've been here for 4 years. And Christine has really thrown a lot out there, really good information. Thank you, Christine. So one thing I'm going to address right away is she talked about anxiety and how different people have that affect us. And with, I believe too, not just with substance use right now, but also with the pandemic, has really raised a lot of people's anxiety, of trouble concentrating. Anxiety can really affect your whole life and give people a reason to use bad coping skills. So one of the coping tools that I use a whole lot is breathing, deep breathing. And I'm going to practice just give you a little practice on box breathing, it's called. So when you're anxious, you tend to breathe quickly, and your brain doesn't work as well when it's not oxygenated. Yeah, oxygenated. So we're going to practice by taking in a deep breath to the count of 4. So you take in the deep breath, count to 4, 1, 2, 3, 4. Hold it for 4, because that keeps the blood that's flowing to your brain going. 3, 4, and then let it out. 1, 2, 3, 4, and hold for 4. And then start again, breathe in for 4. So when you are done doing the box breathing a few times, you will start to feel much more relaxed. You'll start to feel just able to concentrate a little better and remember things better, but also that anxiety seems to kind of flow away. And that's what I work on a lot with clients, is letting anxiety go. Also to focus on what their real goals are, or life goals. So as I said, my name is Dawn Stone, and one of the reasons I was hired as a peer is I have bipolar disorder. I'm also a recovering alcoholic. And while I didn't use opiates, I don't know what addiction is in a lot of different ways. And I have helped a lot of people who have used opiates. And I look at it a lot as it can go right alongside with what I went through with alcohol, because alcohol is legal. Opiates, a lot of people, I would say the majority of people started using opiates with a prescription for pain. They had a legitimate reason, and or they were young, as Christine talked about, or they had traumas. So when you have traumas in your life, or your development doesn't happen the way it should, or the way it could, then you look for ways to maybe deal with those feelings that are unconventional, or as your friends are doing it. So you have a group of friends and they're all trying alcohol, or they're all, smoking cigarettes, they're outside. So you want to try to go along with your friends, and it does affect the person's development. So peers, when we get trained in the field, we become certified through New York State. I'm a certified recovery peer advocate, and I'm also a peer specialist in New York State to work with people with mental health also. So peers are a bridge between the providers and the client's care. So ultimately, we want to be a person-centered program where we adjust people's goals that they set for themselves. Sometimes when they're going through an intake, they're not sure, oh, I don't know, I just want to be sober. But what are those sober goals step by step? Because being sober is a big goal. So we maybe help them look at, well, what can I do today? What can I do tomorrow? And, we look at the simplest goals is, do you have all your life issues taken care of? Do they have food in their house? And really start from the basics. Some people work really hard to be sober, but when all of a sudden they aren't working and they have that downtime, what does that look like? Like Christine talked about having sober supports. That doesn't happen a lot in the in our community. We're a very rural-based community. A lot of people don't have transportation places. So if you walk down Main Street in the evening, what do you see? You see the bars open, you see people congregated on corners, but you don't necessarily say, I'm just going to walk up to this whole group of people and see what's happening. So trying to plan things for yourself. Try to find a couple sober friends that you could trust, or family members. Really, really helps when people have family members that are behind them, but some people also find their own family in their friends that they know they can call on when they need to. So after coordinating the care and maybe helping the person find some social supports, peers can help learn people to advocate for themselves. So a lot of times we are taught to go along with everybody. Oh, the doctor says this is what I need, and that's okay if he gives me a pill that maybe I shouldn't be on because I'm an addict, rather than saying, oh, wait a minute, I'm an addict, I should not take that if it's got a warning that it can cause addiction. So helping them to learn how to stand up for themselves, or they go to the pharmacy, and like Christine talked about our Medicaid assisted treatment program, maybe they get a little bit of stigma at the pharmacy and they say, well, why, what are you using this drug for? And they don't want to talk about it. So we help people just learn how to address these type of things that can happen because we've lived them. I had an issue with a mental health medication, and it was one that was a controlled substance. So on a Sunday, I had a pharmacist tell me that I couldn't get it till the next day, even though I had a prescription from the doctor that said it was good for that day, because there's 31 days in some months and 30 days in other months. And she did not want to hear me. And I ended up changing pharmacies, but not before I cried and almost left there without taking my prescription with me. So because I have experienced that, I can help somebody else say, this is what happened to me, or this could happen. If you need help, here's what maybe you can do. Because I really wished I would have went back and tried to help educate maybe this pharmacist and just said, maybe if you listen to people a little better, or, if you could have heard me, this is what I wanted to tell you. So I have grown a lot in my job that I do, because when I see this happen to others, I tend to get like a mama bear. So now I advocate really well. But when it was myself, I wasn't that, always able to do that. So by being able to share what I went through and say, hey, I truly didn't handle that the way I wanted to. Now I can give that tool, that skill to others on how they can handle some of the bias in our community. And it can happen anywhere, not just our small towns, but bias happens anywhere because they don't understand. A lot of people in the community struggle with understanding some of the things Christine talked about, where the brain development changes when people use substances young. So the maturity doesn't come until they're older. Some people it never comes, because if you continue to put alcohol or drugs into your brain from a young time, and then you try to get sober at 60, which I've seen happen, sometimes there's brain damage. It doesn't necessarily come back. So it depends on where the person's at, what drugs they have used, of what their capabilities are going to be becoming sober. And what I've learned to be non-judgmental people is, if they can learn how to be at peace and happy with themselves, that's all that matters. So it doesn't matter if they become a viable working part of the system again, but what if they just become somebody who is okay and stays home? And yes, they may have to get Social Security or SSD, but they're able to have a productive life, as far as maybe they share their story with other people. Maybe they just learn how not to be a part of the legal system anymore, or an addict, a using addict anymore. I think that's what all peers want. And I think it's definitely what all counselors go into this business for. And that's why it's so exciting that we have the peer network now, because we do try to keep it a network in between different counties. We try to keep up with what we can do for our folks, and anybody anywhere in this field wants to do that. if you do come across somebody that you feel in this field that has biases and maybe, they aren't the right person, it's okay to say, hey, I'm going to look for somebody else. I got to find somebody I feel safe with. I got to find somebody I can trust. Or maybe if you're already part of this field, you could say, hey, let's have some conversations about what people look like to you that have a label. For me, I throw out my labels, but they're just labels and I am not bipolar. I'm not a person with bipolar when I'm talking. I am myself. Took me a long time to get to that point, and it was very hard for me because my family had always had depression. And so when you were raised in a family with depression, sometimes you're more apt to have depression yourself. And that was okay because my dad had depression, my grandma had depression. So that was all okay. What wasn't okay was all of a sudden they said bipolar, and I went, what? And I start reading all these things, and it's like, but I'm not like that, and I'm not like this. But I did tend to have what I felt too was seasonal affectiveness. So give me sun and summer. Yep. And I will talk nonstop and not sit down for 12 hours straight. Give me winter time and I don't want to get out of bed. So that's what I determined. That's my bipolar. That's what it looked like for me. So how can I start working on that? And I just broke it down. And so even though some people, would say, I can't believe she'd say she's bipolar, but that's okay, because then I could share that experience just like that with other people. And all of a sudden bipolar isn't so scary. And I had high anxiety. And some of it was I always worried about being judged. So when I started learning how not to judge, then people that do judge, rather than looking, like, oh my gosh, they might be looking at me or something differently. I just wish them well, that I hope someday they have the compassion that I do for others, because by giving up judgment, that's all I have for anyone is compassion and hope for the best and hope for the future. And when you work with people as I have that don't have that hope, you find ways to just say, look, at even if your hope is just to see another sunrise or to see a sober sunrise that you can remember in a week. There's a lot of different ways that, anyways, you can address stigma and judgment. And I went through my information very quickly, but I also wanted to give time for questions. I did want to mention that peers also can run groups, and they're called like rehab groups. So we work on specific things. One of my groups, my favorite, is art and wellness. So I bring in clients. A lot of them live alone. A lot of them struggle during the pandemic. A lot of them struggle with sobriety or mental health, and they don't have a lot of support. So they come in and we listen to music, we color, we paint, we make crafts. It's very autonomous, where the clients, I check in with them. What do you want to work on? What do you want to do? I have one gentleman that just colors every time. He doesn't want to paint. He doesn't want to make things, but he is there every single week. So he definitely gets a lot out of the group. And we used to have a lot of groups before the pandemic. We had anxiety, we had depression groups that were specific skill building groups. And hopefully at some point we'll have some of those back. Right now we have a large amount of clients who come to us that maybe their problems are a little more severe because of the pandemic. Pandemic and drug use and alcoholism and mental health do not go well together. I mean, if you already had anxiety, and the things that occurred over the past few years tend to raise everybody's anxiety, whether you already had it or not, but you already had it, it's going to raise yours how much more? I mean, how bad could it be? And people who were sober, maybe even for years, might have ended up using again to get through learning how to live in a new world. So I just feel like the more peers, the more understanding we have out there in the community. This is why I do a lot of the talks that I do, is because I see such a high need, not just in our clients, but just in the community in general. for people to say, hey, you know, there's people you could talk to if it becomes to a point where you're not getting through the day, or you're not able to go to work, or you're not able to leave your house, where they see somebody that may be drinking or using drugs that did not before, and they're not, you know, they lose a job or something, then this is where to come. We have 4 peers here at Spectrum. One of our peers is a family peer support. So she works with the parents or guardians of the kids who come here, and she helps them maybe with the school system, or just what the child's needs are, where to get those met the best. And we also have another peer, and her experiences are very different than mine. She's younger. So we're hoping eventually to have somebody that can, you know, everybody can relate to. We'd love to have a male peer. That's their goal. But we do work with another agency in Batavia, and they have several male peers. So sometimes I call on them just to say, hey, you know, maybe could you talk to this young man? Or I remember going to see a young man at the mental health unit, and he's looking for his peer, and I walk in and he's still looking for around me, like, where's my peer? And I'm like, yeah, I'm your peer. I know I don't look like you, but I've been where you are. So, but hopefully, you know, as we expand and our services become even stronger, we'll have more peers, more faces to be out here helping people. And if there is somebody on here that's listening from other counties, there's always a peer network at some place, usually in your county. If not, you can call Wyoming County. We have a couple different peer programs. So is there questions about peer advocates and what we can do? Is there any questions in the chat?
Yeah, you can put it in the chat, or if you want to ask Dawn, you can unmute, or you can use the Q&A option.
So one thing I didn't talk about was we have a consumer advocacy council here at Spectrum. And so that is made up of clients, and they're all peers to each other. And we do a panel where we talk on education on mental health and substance use disorder. And we also get out into the community and try to get the word out about the peers and how effective we can be in helping people on their journeys.
How do you become a peer?
Well, there's a certification through New York State. You go online, there's 2 different, you can go through New York State mental health office, or OASIS, which is the Office of Alcohol and Substance Abuse Disorders. So go on the website, and if you just put in certified peer, they should both show up under Google, and it'll explain what the basic requirements are. There's some classes, usually takes just a couple weeks in classes, and then getting some paperwork together, your degree, your high school diploma, something like that. Pretty much you need a high school diploma and an access to the internet, and you're pretty well set to get certified as a peer.
Very cool. How many people might a peer work with? You said you have 4 over at Spectrum. How many maybe individuals might choose to work with a peer?
Well, our goal is 20 to 25, because we do give a lot more time to each client. We work with higher numbers when we have a lot of clients that want peer services. So it depends. Some people we work with every few weeks. They just need to touch base with us, and you know, they're doing really well, but they want to still talk to us. Some we talk to 3 times a week. I text a lot of clients. That helps a lot to save time. And if they have an issue, they know if I'm not going to get back to them right away, maybe they can find out when by texting me. So it does vary. And it's just like anywhere else, we're looking for more people. Unfortunately, a lot of places are short-staffed. So hopefully, if we have anybody on here interested in being a peer that wanted to specifically hear about it, yeah, it's definitely a good time to get into the field. And it's such a good helping skill. So is being a clinician. We also need clinicians, definitely. And Christine's awesome. She's been here 10 years, so she has such good knowledge of what it looks like to be in drug and alcohol treatment. And I think we've really covered a lot in this session.
Yeah, this has been great. I wanted to ask Christine, she was talking about the different reasons that people may get into addiction, trauma, or maybe family members who are using. What in your clientele or in the patients that you see, like, do you see it heavier in one area, maybe starting at a young age, or maybe due to prescription drugs? Like, do you see one more than the other, or is there a combination?
More trauma versus prescriptions, you mean?
Yeah, or just what do you see in your patients? What, like, the reasons that people get into, maybe get addicted, are addicted? Like, is there a group of patients that you see that tend to be more individuals that have dealt with trauma that's kind of led to them into addiction, or maybe their parents were users and they grew up with it, maybe they were born into it? Like, what's heavier?
So I would say with opioids in particular, most often it's getting prescribed something, legally prescribed something at some point, and then it turning into an addiction. With trauma though, I in my experience, I think there's more trauma out there than people realize. There's more trauma that people have been through than they realize, but there's still this thinking that I don't see quite as much anymore. But like I mentioned, the whole military experience, for many years, people associated PTSD with military experience only. So if things happened in their life, traumatic events happened in their life, they didn't perceive it, it's causing these symptoms. There wasn't that knowledge about it. So I think trauma is an underlying factor to a lot of people who end up developing addiction. It just looks a little bit different for everybody, because everybody has a different life experience, obviously, but trauma, I think, is definitely up there. I just don't think people recognize it right off the bat.
Mm-hmm. Mm-hmm.
Like, the further they get into their treatment, I think then they start realizing, oh, wait a second, this was a very traumatic thing, and this was a very traumatic thing, and I had this happen, and getting more of that knowledge about themselves and how it creates these symptoms, I think then helps them make those connections too.
Gotcha. Can you tell me about the mobile unit a little bit? Is that a part of Spectrum? Dawn or Christine? I think that's interesting.
Yes, I meant to bring that up. So the mobile unit is an RV put in, it has a therapist's office in the back, like a little waiting room in the middle, and they take it right now. The way the clinic works with it is we take it to a doctor's office, and we also take it and have it sit at a DePaul housing unit. So it's a lot of people live there, and they could come out and receive therapy there. There's a therapist and a peer on board, or it's a way to connect with coming into the actual clinic, so they could come there and get signed up, and then, figure out transportation and different needs and barriers that they may have to actually coming to clinic. For some people, it's so much easier to do something like that than to come into the doors here at clinic. Some people, that's a very huge fear. We've used it to go and advertise, because it says Spectrum Human Services on it with the phone number, and to show people that we will go outside the four walls to reach them. There are people here that really care, and we really want to be out there in the community and help people. I know one time it was sitting at the doctor's office, and actually one of the nursing staff from there came and knocked on the door and asked for help for a family member. And she just got a lot of information on what to share and how to share it, how to have that difficult conversation that, hey, I really think you might be having a problem right now. Doesn't mean that it'll always be or always was, but there's a place where you could get a little bit of help with that. Would you be willing to talk with somebody with me? And just like give her a little bit of information on how to be a good peer to their family member. So it's always great when we have ways to reach out to people maybe that can't get here with transportation. We're also going to be having a crisis center where we can reach out a little more with crisis calls or visits. Right now we rely on Erie County crisis for a lot of our crisis calls. So this way it's going to be a little more in county, and we may even possibly be able to use the RV that way to go out when people are in crisis. So it is a revolving asset to our agency. So it is exciting. It is winterized, so they drive it in the winter too. It's funny to see it going down the road when it's snowing now. But that's what we need here. We need consistency. We need outside maybe the four walls to help people connect and realize, you know, that it's not as scary as they think. And some people come here for a short time. You know, they've been sober for a couple of years, but because of the pandemic or because they had a loss in their life, they're struggling again. And they can always come back for a time and, you know, connect and work on those skills specifically and how to get through the harder times. So.
And I just wanted to add too that the mobile unit, is that it helps really bridge that gap. Because in this area, one of the barriers that we struggle with is access to things. And I mean, even if we're just talking about treatment, transportation is a major problem. There's just lack of transportation. I mean, that's one of the biggest barriers that I struggle with a lot of clients that can't drive, is trying to get to appointments. So it helps just to kind of bridge that gap where there's, you know, another provider out there that's maybe a little bit closer to them that they can get to. And maybe if they're not 100% comfortable with actually coming into the clinic, kind of easing those nerves a little bit until they are more comfortable to come in and actually come on site and get the extra help there.
Is it strictly Wyoming County? Where would you see the mobile unit? Is there a region that it would travel or limits?
Lately, it's been in Perry, in the Perry area.
Yeah.
I think the goal is for it to travel more around the county, but lately it's been in Perry.
Okay. We do have a question in the Q&A. To be a peer, do you have to be a peer to the person who has an addiction or mental health disorder, or can they be a peer to say a spouse, a parent, or a child of someone who is addicted or has a mental health disorder?
So you can be a peer to whoever is willing to accept help. When you work with somebody, peer skills of having the difficult conversations or just being a good listener is being a good peer also. If it's a child, a teenager, sometimes that person in their life that listens to them is the person that really makes the difference of whether or not they go down the road of, oh, well, everybody's using, I'm going to go this way. Even though they had questions, maybe they could have asked a trusted adult and said, hey, you know, if everybody's doing this and they're pressuring me, you know, can you help me try to figure out what I want to do? And just being that person. Same with a young adult, same with an elderly adult. I work with people of all ages other than under 18 because we have a family peer that does that. But even though she works with a family member, there are times where she talks to the child also just to be there. And usually the clinician is actually meeting with the child. So you can be a peer to anybody in your life. I go work out at the Y, and I've recruited 3 different clients from there just by talking and being a good listener and saying, you know, maybe you do have something you could work on. And honestly, I think that for any of these issues, everybody should look at mental health, because basically it all boils down to mental health. You know, you're helping them on their journey to being at peace or happy or being a better, whatever it is they want to be. And so that's anything. And that in the long run, it all boils down to their mental health. Can they handle this? Can they handle a harder job? Can they handle doing this or that, or trying to get sober? So there's a lot of different ways to look at being a peer. So absolutely. And you don't have to have specific trainings to be a peer. Just that with some training, you do learn kind of how to not get overwhelmed with people trying to help people. and how to help them with boundaries so that you take care of yourself also.
Is there any other questions? Any questions? I really appreciate that you guys and that Dawn, who was on vacation, came in today to talk with everyone. I thought this is some really great information. Is there anything you want to add? If you don't have any more questions, anything you want to add before we end?
No, but thank you for inviting us. We truly appreciate it.
Well, it was great to hear you speak, both of you.
Thank you.
Yeah, thank you. And thank you for everyone who came in today. Next week, we will be having another webinar at 12 on Tuesday. Carl Shalahorn will be speaking next week on co-occurring disorders and addiction. So if you would like to join in next week, you are welcome to. And I hope everyone has a great afternoon. And again, thank you, Christine. Thank you, Don. Thank you, Spectrum Services. And everyone have a great week.
Thank you. Take care.
Bye.
Bye.